Thank you for the opportunity to advance into Synthetic Health Data Challenge Phase 2. Our team solution is incorporating SDOH data to predict diabetes progression in patients with prediabetes. This video is presented by Annie Chan and Julian Pan. Our challenge category is number 2, novel uses of Cynthia-generated synthetic data. The healthcare use case we're trying to solve here is complex care, specifically for diabetes. According to CDC statistics, over 88 million American adults have prediabetes. That is 1 in 3 adults in the US. Without taking proper actions, many of these people with prediabetes could develop type 2 diabetes within 5 years. Our objectives for this project are to use Cynthia to produce realistic synthetic data for prediabetes, diabetes non-clinical research. 2, to demonstrate novel uses of Cynthia-generated synthetic data, incorporating social factors to predict type 2 diabetes progression using machine learning approach. Our proposed solution framework has 4 components. First, we use Cynthia to generate synthetic data. Second phase is synthetic data validation. Initial data output is validated using real prevalence. The data is stratified and validated in multiple levels by state, county, as well as by gender, race, ethnicity, and age groups. If the validation results is acceptable, we next use the validated synthetic dataset to create predictive model for disease progression. If the validation results is not acceptable, we move to component 4 to create new diabetes module that could produce more realistic synthetic data. Once a new diabetes module is created, the process moves back to component number 1 to produce a new set of synthetic data. We created 3 new synthetic diabetes modules, adding age, gender, and education. Overall, 12 simulation runs covering all 52 US states and 6.24 million patients created for the project. This slide shows the county-level diabetes prevalence comparison for US adults age 18 and older. The left map is the real prevalence rate from CDC National Statistics. The right map is produced using synthetic data from original Cynthia type 2 diabetes module containing 1.5 million adults. As you could see, hotspots on the left map are southeastern region of the US. For example, states like West Virginia, Alabama, Kentucky, Mississippi, Georgia, Arkansas, just to name a few. However, Cynthia data did not produce these hotspots. In addition, rural areas have a more significant prevalence discrepancy compared to urban areas. This slide shows diabetes prevalence by various characteristics. Overall, US prevalence is approximately 9.2%. Module 1, output from Cynthia, underestimate with a difference of approximately 3%. There are also issues identified by age groups. For elderly population, age group 65 and older has large discrepancy. Cynthia underestimates almost 15% of the diabetes. The discrepancy widened for age group 75 and older. Similar issues by gender and race ethnicity. Without further tuning the original Cynthia diabetes module, the synthetic output data is not realistic and could present skewed health disparity issues. The rightmost column shows validated results for module 4, newly created diabetes module by adding gender and age interaction. The prevalence rate is improved significantly across all characteristics, much closer and much realistic to real diabetes prevalence. It is approximately 0.3% away from real prevalence at the national level. The last component of our solution is to explore applicability of training machine learning models using Cynthia-generated synthetic data. We built and trained 2 machine learning models. Variables in the model include demographic information, clinical variables, as well as SDOH factors such as education, food insecurity, housing status, employment status, and if a person has access to vehicles. Thank you again for the opportunity to present our work. We found Cynthia Generator easy to use, flexible, and most importantly, could produce realistic synthetic data with proper parameter tuning. We plan to apply the solution framework in this project to other disease areas. We also hope our positive experience and collective efforts contributing to the open source Cynthia community would encourage and enable researchers and developers in health IT, public health, and health policy advisory committees to leverage risk-free synthetic data.